Good morning, everyone. Thank you for the opportunity to present. Yes, so my presentation will be focusing on the contribution of Earth observation data towards preparedness for human disease outbreak. And also we'll share some lesson learned now through the experience during COVID-19. Earth observation technologies, including satellite remote sensing, play an important role in terms of preparedness, management of pandemics, and also identification of high-risk communities or areas that are at high risk of human health or animal health. With the technology, we are able to acquire images over various scale, from global scale to higher scale, looking at a village or a street view, depending on the application. The advantage of using Earth observation data is that we are able to go back and have a historical view in terms of what happened during historical pandemics, so that we can assess the environment and see if there are any lessons that could be learned, but most importantly, then model for future outbreaks and help then in terms of preventing or minimizing the risk on people and also on animals, if applicable. So with the technology, we are able to map and monitor the environment, but most importantly, to map the indicators that could be the source of some of the health outbreaks. For example, looking at water quality, we are able to map and monitor water quality over a duration of time. But the advantage of this is that instead of focusing on just one area that field workers can do at a time, we are able to then look at a larger geographic area and then assess over time in terms of the temporal changes at a particular area. The same can be done looking at air quality. We can also map exposure to heat extremes, which are threatening human health. We can also map and monitor pollution, identify communities, vulnerable communities, in terms of access to services, but in terms of their proximity to some of the high-risk areas. We can also use remote sensing to identify areas at risk. For example, looking at vegetation conditions, humidity, amongst others. We can then start modeling in terms of what will be the impact of any health disaster in the community, and most importantly, then try and prevent the high or the negative impact. Another value of using Earth observation data is that we are able to assess access to health services, which are required not only during pandemics, but in our everyday life. Most of the time, this information in terms of access to services or accessibility to services, it's acquired during surveys or censuses. But we all know that that information becomes outdated because it's a very expensive exercise, or otherwise targeted. It's targeted at a particular area or project, meaning that when we need that information in terms like this, sometimes we don't have a national view in terms of what is happening in terms of communities or access to services by communities, services such as health, water, amongst others. So with the technology, we are able to map and monitor communities and accessibility to services, their environmental conditions, amongst others. At the South African National Space Agency, we create what we call core data set that helps in terms of mapping and understanding what is happening on the environment in terms of the natural resource and also the human activity on the ground. So one of the core data set is vegetation layer, which we map from Landsat and Sentinel images. This shows us all the vegetated areas. And then because we have access to historical images and also up-to-date images, we are able to monitor over time in terms of the changes that are happening on the ground and integrating this data with other data from, for example, weather services on rainfall, humidity, amongst others, then we are able to provide some data that can be used as input during modeling of some of the pandemics or diseases. We also monitor water bodies. This is looking at small or big dams across the country. This allows the decision makers from those who are looking at provision of water to understand what is happening in terms of the natural resources. But what is also important is that we are able to provide information on water quality in terms of algal bloom mapping in most of the big dams. This information then helps in terms of management of the water resources, but also it helps in terms of identifying some of the sources of the pollutants that could be causing some of the problems in the water bodies. Monitoring the water bodies in residential areas, especially in informal settlements, also helps in terms of understanding the quality of the water that the informal settlement dwellers could be using, which could also threaten their life because of the quality and, of course, lack of running water in those particular areas. Another core data set that we produce is the human settlement layer, which maps out location of human settlements. Human settlements are indicators of population. As you are aware, population data is also scarce, especially if you're looking at a national level. And during pandemics, such as the COVID-19, information on where people live is very important to ensure that the interventions that need to be made on the ground do not leave anyone behind, because if we concentrate or use only the available demographic data, then a lot of communities will be left out since they were last surveyed maybe more than a decade ago, or almost a decade ago. We also assess access to services using other sensors like the night lights, which then helps us in terms of identifying areas that have access to electricity or street lights. So this information is also important when we are managing a disaster like health or relating to health, because it talks to accessibility during emergency in terms of helping the people who are in need. So I will share with you how some of the data that we have was used during COVID-19. One application was for the identification of socially vulnerable communities. So these are communities that lack access to basic services and such as water or housing. So we were looking at socially vulnerable communities in terms of their environmental condition and access to services. So with Earth observation data, we were able to map the location of such communities, which are mostly informal settlements. So you can see the spatial distribution of such settlements across the country. This was done using the 2020 satellite imagery, providing then the most up-to-date data that can be used in terms of understanding the condition of our settlements, and hence then help in terms of making decision in identifying those settlements that require intervention, whether it's in terms of temporal shelter or temporal quarantining centers, amongst others. So this picture also shows location of those settlements with access to streets, and also those without access to streets. Accessibility, it's very important during disasters, because then if not known, people could be stranded in certain communities due to lack of access in terms of road infrastructure. Another data set that we contributed is population density, but looking at the spatial distribution of the settlements. So this helped then in terms of understanding how the settlements are distributed spatially, so that the decision makers can then have more information before they even go on the ground in terms of how much services is required. For example, looking at the distribution of water tanks. So this information then helps in terms of doing the, in terms of allowing the decision makers to do an initial analysis before they go on the ground and make sure that they have enough resources that they need to support the people on the ground. Another application was to also to assess the proximity of communities to health infrastructure. So what we're seeing here is a map of settlements, and yellow representing the settlements that have access to health services, looking at 25 kilometers to public hospitals, and 5 kilometers to clinics. So the areas that are shown in red, these are the areas that are further away from the buffer that was used in terms of proximity to the public hospitals and clinics. So this information then helps in terms of planning of services that may be required, and also in terms of identifying maybe the centers that areas where they could develop centers or establish centers to help the communities that are located further away from the health facilities. We also assisted in terms of mapping access to water. So the picture shows settlements around Mamelodi in Pretoria, and we were able to map areas with access to water in terms of whether the water is accessed through the street tap or whether it's water tanks. So this information was only possible through the integration of Earth observation data and also community-based GIS. So this information was also used during the planning of provision of water. We also assisted the Department of Small Business Development in terms of rolling out the Spaza Shop Support Program, which is aimed at empowering the Spaza Shop owners and ensuring that they had enough food supply required during the lockdown to ensure that communities have the essential products that they require, but most importantly that whatever they require, it's within reach in terms of reducing the the travel distances, which may increase the transmission within the communities. So this is one of the layers, or a service which was new, developed straight to assist the department during the COVID-19. The points that we seeing represent those spaza shops which were supported, but only up to June. If we look at what is done now, they will be having more points on a map than what we have now. So this information was useful, or is useful now during the pandemic, to make sure that the spaza shops owners are supported, but also the information can be used in the future by the department when they're looking at supporting others, entrepreneurs or businesses in particular areas, because then this initiative will allow them to assess what is happening in particular areas, what kind of businesses are there, and where's the community that they will be serving, so that whatever is being developed could be sustainable. We also assessed the air quality during and before the lockdown. So from the pictures, we can see that from the week of the 1st to the 7th of March, we can see that the CO, which is the carbon monoxide from cars, was a little bit higher compared to the time when we entered the level 5 lockdown. So we can see that since a lot of things, or a lot of activities were not taking place in terms of economic activities and movement across cities and the country, we can see that the CO emissions were reduced during lockdown. So the information that we have in terms of locating those areas with high emissions of CO can then be used, during the implementation of some of the strategies that are being presented on biodiversity and green economy, amongst others. So the information that we have access to then allows us also to go back to before the pandemic, or even maybe during the previous disasters, to see then what has been the trend, and then help then in terms of making informed decision based on what we are able to see from imagery. So in addition to the value-added products that we provided to government departments, we also provided high resolution, very high spatial resolution images, which allowed for the departments to do a detailed situational analysis of particular areas, especially looking at the high risk or hotspots areas during COVID-19, to help with the planning of the services required on the ground, and also to help in terms of making sure that communities are protected and they have access to the services that they require. So it is only with access to up-to-date high resolution imagery, depending on the application, that we can have an understanding of what is happening on the ground, which is not always available. And if any planning, whether it's service delivery, whether during normal time or during disasters, if it's done without the use of up-to-date information in terms of where people are, then the outcome might not be desirable. It can also lead to unnecessary delays. So to support the use of data and also visualization, we have developed a decision support tool, and that's the link with all the products that we have access to. So this allows the users not to look at one land use at a time. For example, looking at forest without an understanding of where people live. So this allows the users to have an understanding in terms of what is happening on the environment, the state of environment in terms of quality, water quality, pollution, and also look at the human activity. So already by just visualization or visualizing from this application, one will be able to make decisions without even accessing the data on their desktop in terms of where the intervention should be taking place depending on the interest. We also created dashboards to support the visualization of data relating to human settlements, location of informal settlements, access to services, amongst others, to support decision-making in that regard. This helps also the non-remote sensing and GIS users to zoom into any area of interest and assess in terms of numbers, location, and help identify those areas that require intervention. We also developed the same, more or less the same dashboard for the Department of Small Businesses, also to help with the decision making or visualization of data relating to small businesses. So even though the work started now with other departments who were not users of remote sensing data, we hope that we will be able to continue to support them further post the pandemic. So in terms of lessons learned, we need to do more of stakeholder engagements, and this does not need to wait for any disaster. This will allow the users, who are mainly government departments, to understand and appreciate some of the data sets that we develop or that they have access to from our organization. And then we can also use this engagement then to demonstrate how the data can be used to support decision making, or in fact, yes, to support decision making, to complement what they already have, not to replace what is there. This, of course, needs to go hand in hand with awareness and also capacity building to ensure that the users can use our data with ease. But most importantly, the most important lesson is to for us to prepare or to develop health analysis ready data. This would allow the users to have information that they require to, whether it talks to the environment, whether it talks to services, in a user-friendly manner that will allow any user to understand the data without having to interpret or maybe to switch on and off the layers. So this is something that we'll be working on to ensure that we promote the use of Earth observation data in preparedness management and also post some of the health disasters. I think this is the last slide. Thank you very much for your attention. If you require more information, you can visit our website. You're more than welcome to also just email me. Thank you.